Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today it is a huge honor to have a guest who, in Samantha Leonard, has been in the dental industry for over a dozen years. And what she has done in her dozen years in the dental industry is she's worked in pretty much every role that there is, other than dentist, right? Helping as a practice manager for a well-respected and world-renowned orthodontist, Dr. Sam Dare. Yeah, I think I'm saying that right.
Yeah.
And together they started and built a multi-million-dollar practice from scratch. So her managerial experience has helped her appreciate and identify the negative effect of a wrong hire. And that's what we're going to talk about today, is how you can actually get some systems in place, get some tips, some quick actionable tips. We're going to talk about the 5 things that you need to know when you're hiring. And, basically Samantha has, through her experience with this orthodontist, she's helped kind of find out some of the red flags that you can look for and some of the pitfalls and dangers involved in hiring the wrong person for your practice. And that, of course, doesn't mean that they're a bad person. It just means that they're not the right fit for your practice. And so we're going to dig into a lot of those details. But first of all, how are you, Samantha?
I'm great. I'm excited to be on here. Thanks so much for inviting me.
Yeah, my pleasure. So we are definitely going to get into some actionable tips. That's what we're all about on this show, to help our listeners know how to hire the right person and know how to kind of set everyone's expectations for success. But first of all, could you tell us a little bit about your story, how you got into dentistry, why you got into dentistry, and we'll take it from there.
Okay, that sounds great. So yeah, like you mentioned, I've been in the dental industry for over 12 years. I actually started off as a dental assistant. So I did that for about 5 years. I worked in an orthodontic practice and really loved being a part of changing people's smiles and their lives, right? Like you could see somebody just transform and gain that confidence as soon as you started straightening their teeth. So I absolutely loved that. But after 5 years of being a dental assistant, I kind of felt like it was time for me to grow and to add on some more skills. So I eventually started transitioning into other roles in the practice. So treatment coordinating, I did admin, but it wasn't until I actually started working with Dr. Dar when he hired me to start his satellite clinic in a city where he doesn't even live. He only flew into practice 4 days a month. So I was basically the business owner. That was my baby that I was growing from scratch. So I was employee zero, as I called myself. I did everything in the office, like TC, admin. I also did the ground marketing. I was the assistant. I was doing payroll. I learned the business side of dentistry. And it really helped me learn a lot about the difference between the two, right? It's just one thing to be able to manage the clinic and making sure everything's running smoothly and on time and patients are happy. But another thing is making sure that the practice is actually profitable, right? That it can pay the bills, it can continue to grow, and the dentist can really focus on their passion and really changing people's lives. So it was a great eye-opening experience for me. Together, Dr. Dar and I grew that practice from scratch. It became a multi-million-dollar clinic. And then he started acquiring other businesses, other practices. So I was a part of the onboarding and integration of the new offices and really implementing our systems and getting the entire team on board. And soon we had 6 offices across Canada. So I was really busy, but I loved learning. I loved that entire aspect. But as we were growing, that's when I really started to notice that there was a lack of support in our industry when it came to hiring, when it came to human resources. Because when it was time for us to find that right team member, I just kind of felt like the way that we were doing things was just very archaic, right? It was just put up a job ad and just wait for that right person to come if they even show up, right? So it was something that we decided that we wanted to be able to solve that problem and really streamline that. So that's when we started working on Stream Dental Staffing Solutions, and we launched that about 3 years ago. So here we are. We've expanded across Canada and down to the States. And it's, the more I work with offices and clients, the more we start to notice that this is a challenge that every single office has, right? Trying to find that right person and trying to create that office culture to find your dream team so that everybody is on the same page, working together, taking care of patients and making your practice successful. So that's what I'm passionate about.
Yeah, it's interesting. They say one of the best ways to start a business or to get a great business idea is to first look at what problems do you have and then solve those problems for people like you.
Totally.
So you start off with this understanding of, okay, this is a problem for me, so I understand me. How many other people are there like me? So that kind of sounds like what you did.
Exactly. It was just like, it started off, like you said, being kind of more selfish. It's like, how do I make this better? Like, I don't want to keep going through these nightmares and having these headaches and hassles every single time it was time for us to hire somebody, and really just streamlining that whole protocol, because it's more than just filling that vacancy, right? It's there needs to be a lot of structure. There needs to be time that you need to take ahead of that actual instance to be able to know who exactly is the right fit for your practice, right? Then it's a lot easier to screen them. It's a lot easier to be able to find and attract them. And once you have those right protocols as well, it helps you onboard and integrate that new hire so that they're long-term and loyal team members. So I almost kind of created a formula of what was successful for our practice. And I'm proud to say that a lot of the team members that we hired when we first started are still there. So people have been there for 5, 6, 7 years plus. And the only reason why we needed to hire was just to kind of fill our growth. And, that's a great problem to have. So I wanted to be able to pass on that knowledge, pass on that experience to other offices out there.
How much do you think orthodontics in Canada is different from general dentistry, say they offer Invisalign in America? How different is that from a hiring and firing perspective?
It would be the same protocols, right? And really it just kind of comes down to the first step that we always like to work with our clients is really understanding what their 5-year growth plan is, right? Because you want to be able to find that person who can add immediate value now and who can help reach your goals faster, right? Versus trying to fill the immediate need that you have at the moment, because that's just a Band-Aid effect. And what ends up happening is they end up overstaffing themselves, because as they continue to grow, they see that there's more responsibilities, there's more duties that might need to be taken care of. And that person that you hired can't do that, right? You didn't hire them for that specific role. But if you have that long-term and short-term aspirations in mind when you're hiring somebody, that solves both problems.
Perfect. So what are, we're dying to know, what are the 5 tips, or is it 5 pillars to success? How do you phrase it?
I would say that there are 5, I call it 5 simple steps on how to be able to find the right person for your practice and how to get it right the first time. So we already kind of touched on to number 1. So it's really identifying who your ideal candidate is. And that really starts by understanding what your 5-year growth plan is. So usually there's quite a few steps that we like to take when we're working initially with our clients. We like to figure out what their mission statement is, what services they're currently offering now for their patients, but also what they want to introduce. Because dentists, they love to learn. There's brand new technology and software and services that are coming out all the time, right? And they want to be able to offer that to their patients. So maybe along the road, they want to learn how to do implants, or they want to start offering Invisalign in their practice. So if that's their goal, wouldn't it be amazing to be able to find somebody who has experience with that? So you can kind of see how that individual would add value now, but also will help you implement the needed changes and implement the systems, the structures that you need so that you can introduce that service and, avoid that learning curve. So that's what we always, kind of work one-on-one with our clients and really understand the direction that they want to take their practice. And then the next step is to really, so once, I always like to say, once you kind of know who you're looking for, it's a lot easier to be able to find out how to look for them, right? So then it kind of, you create a roadmap, or you create a structure on how you find that individual. So that goes down to pre-screening them, right? It's really understanding the types of questions, the keywords that you need to look for on that resume. So in that way, finding the people who are going to fit those parameters that you've developed, who have the skills, who have the qualities that you're looking for, versus just seeing a resume with somebody who has dental experience and being like, sure, that's good enough, let's hire them, right? Like, you could be setting yourself up for some potential big down the road, if not immediately.
Right.
And then yeah, like, it really goes down to effectively screening and interviewing them. So one thing that's really, really important is just to make sure that you have a checklist, you have a job description that you're using to be able to find the right person for your practice. So once you kind of know the intricacies, you know exactly what the requirements are, you know what's involved in that role, then you're like laser focused. You know who you need to attract, how to attract them, and how to be able to find them. So we like to work with our clients to be able to create those interview questions to get the right support, the right candidates for their practice.
So the checklist, is it, for instance, is it something that we could create as sort of a boilerplate that you have that you can offer clients, or is it something that you start off with a template and then you customize it for them, or is it something that needs to be started from scratch every time?
Well, it's something that we have a template, we have a foundation, and then that's something that we like to kind of customize and fill in those missing pieces for each practice, because each practice is different. You know, the team is different, the roles, the expectations are different. So we want to make sure that it's custom and it's specific for that practice.
Maybe some just kind of mile markers as far as some of the checklist items that tend to be most important.
So in terms of finding the resumes?
Yeah, in terms of like, so if so I'm a dentist, I'm watching this show and I'm like, okay, so I need a checklist, but what do I put on that checklist?
So the checklist that we always start kind of by doing a job description first. So that's kind of taking the information that we were talking about earlier about the types of services that you offer, the direction that you want to take your practice, and then just combining all of that information and lining it up to figure out what that ideal candidate would look like. And then we always split those up into 3 different categories. So what are your must-haves, which is, you know, the bare minimum. So for instance, if you're a really busy practice, you don't have the luxury of time, you don't have that additional staff to be able to train somebody on your practice management software program. So you don't want to look for somebody who doesn't have Dentrix experience, right? Because that's a huge undertaking to train somebody on a program, right? It's almost kind of like figuring out a new language. So if you don't have that luxury of time to be able to train somebody, then that should be in your must-haves. And then we have our nice to have, which are things that are kind of bonuses. They're additional perks that would be, you know, if you're looking at introducing Invisalign, somebody who has Invisalign experience. And then our last one is the non-negotiables. So there are, you know, that one's pretty self-explanatory. What are some things that you are absolutely deal breakers for you? So maybe that could be you have a specific salary range that you want to stay within. So in that way, you don't kind of increase your overhead unnecessarily. So that would be a non-negotiable. Or maybe if you want to find somebody who lives close to the practice, as opposed to finding somebody who lives an hour plus away, that candidate may say, because they want to find a job, they're desperate to find a job, they might say, I'm okay with the commute, but then come a couple months into the position, if they find a job closer to home, you're going to end up right where you are at the moment, right? So there's those 3 areas that you really want to kind of be specific on the types of traits and qualities that you're looking for. And then once you've created your job description, there are going to be some keywords that really pop out to you. And so I always kind of suggest to use those keywords on your checklist. So in that way, when you're pre-screening the resumes, you can see if this individual has that keyword on their resume, or if their roles and responsibilities match with, what you're looking for at the same time. So it just really helps kind of narrow things down, versus just getting one single resume and just deciding to call that person in for an interview.
What is your opinion as far as I've heard it both ways. So some people advocate for under the must-haves. Some people say you got to have dentist experience or open dental or EagleSoft, whatever the case may be. Some people say, don't worry about that. They can learn it. Find the best personality. Find like a waitress or somewhere, a banker, or someone in some kind of sales or customer service, and that you can teach them the practice management software. Anyone can learn that, but what you can't teach is the personality. So how often? Because I imagine, like, if you mention Dentrix as a must-have, if you were to even suggest that to many of the people watching this show, they'd be like, yeah, they got to have that. But how important is it in your experience when comparing, like, say you've got an ideal personality, someone who's really willing to learn, versus someone who is maybe good but not an all-star in that department, but they know Dentrix? Is there a way that you kind of help dental practices kind of figure out, like, which one is better?
That's a really good question. And, definitely I'm a huge advocate for finding somebody who has that right personality, because in our industry, like, I feel it's changed in the last 10 years. Before, dentistry used to just be healthcare, right? People would just go in, they would have a pain, they would get that taken care of. They didn't care if you were nice, you had good bedside manner or not. But now the competition, our market's really saturated, right? So if you don't provide a patient a good experience, they're going to walk across the street to the other dentist, and they want to find somebody who they know, like, and trust. So that patient care is huge. So if you can find somebody who has that high level of customer service, somebody who can develop long-lasting relationships with your patients, that is much better to find than somebody who has the skills but lacks a personality. Right? So it is definitely a catch-22, but at the same time, you need to kind of evaluate, can your practice even train somebody who has no dental experience? Like we kind of talked about a little bit, it's learning a new language, right? The terminology and having to explain insurance, that's a huge undertaking. So if you have the additional resources, if you have the additional staff members to be able to provide that support to that new hire, then go for it. I think I've done that before. I've trained somebody who had zero experience and was one of my top employees. But it's because we had the resources. If not, you're going to be setting that person up for failure. And the rest of your team is going to be overworked, overstressed. So it's those two items you really have to weigh out. And so that's something that we work through with our clients as well, and really kind of understand what their practice can handle in terms of that.
That makes sense. Kind of going off on a tangent there. I'm going to go off on a tangent, but
I do it all the time.
It's kind of like you made me think of, okay, they have the dental experience, but what kind of dental experience? So, for instance, one hygienist versus another hygienist, they might have completely different philosophies on how to do things, and the words that they use might be different than the dentist, and the recommendations that they make. It can all be so different. So in your experience, what's more important? Do you think it's someone who's trainable or someone who's been trained? And I don't know how much it fits hand in glove. I don't know how much, like, if someone comes from another dental office somewhere else, for some reason, I feel like they don't always fit hand in glove with the clinical philosophy or the customer service philosophy of the new dentist. But maybe you could talk on that. But more importantly, what's the more important thing? Is it the coachability? Is it the teachability? Or is it more of like, okay, the efficiency, we can let them handle it their way?
Well, that's another really great question and another great point to build off of. So again, I think coachability is key, right? Because like you said, two practices are the same. They have different values, philosophies, different way of thinking, different systems, different procedures. So you want somebody who can easily come into your practice. Yes, that's going to be some investment of your time to be able to train them into your methodology, but they need to be able to be on the same wavelength as you. Because if you, let's say, we'll go on that same wavelength about that hygienist. So let's say you had recommended for that patient to get, I don't know, a couple of veneers. So the hygienist is with the patient, you recommend the veneers, you walk out, the hygienist is telling them something different, right? Like, how does that make that patient feel? They feel confused. They just undermined your authority by just, just kind of devaluing that treatment that you just proposed, right? You want to have somebody who has that same wavelength and someone who can really understand what you're trying to accomplish for your patients, for the community. And it all boils down to what your mission statement is, to be able to find somebody who has that same philosophies and values. If they don't share it, it's something that they're willing to learn. But I think that's extremely crucial for everybody to be on the same page to be able to reach your goals. If not, you're going to be just spreading yourself thin, and lots of talk happens and drama, and yeah.
A lot of I know a lot of practices that think they just need new patients, but what they really need is they need to join forces with the team, and that's going to spur a lot of word of mouth. Which I'm not an expert in how to do that, but I've seen it before. I've seen it where, the word of mouth just isn't there. So for instance, you could do SEO, you could do direct mail, you could do AdWords, whatever it is that you're doing, and then you get those new patients, but then those new patients can leave at a higher rate than industry average, and they can also not refer at industry average. And in both cases, you're not compounding your efforts. You're not really building off that marketing so much. So the lead gen is, you get a much lower ROI when you don't have user or patient generated content, those reviews, the word of mouth and all that. So where are we at? We actually got off on a tangent, but you were doing
I love
things, and I think we're on number 3, right? Well, can we recap it real quick?
Okay, so number 1 was to figure out who your ideal candidate is by reverse engineering your 5-year growth plan. Number 2 is how to find quality candidates for your position. Number 3 was how to effectively screen and interview. And number 4 is understanding, or actually implementing an effective onboarding and integration process. So this one I might go on a little bit of a tangent on because I'm really passionate. So it's one thing to be able to find that right person for your practice. The next thing is to make sure that you're setting them up for success, for them to be long-term and loyal team members. So this is something that I've been guilty of, and this is something that I see actually on a regular basis in many practices, is that on day 1, the new hire just gets a typical orientation. So, here's your operatory, here's where everything's set up, here's your column, here's your first patient is in 10 minutes. I'll see you at the end of the day, right? Like, they're extremely nervous. This is their first day. They don't know the doctor. They don't know their team. They don't know, how the structure, how things are flowing yet. So you basically just push them into the deep end, and you're expecting them to turn into an Olympic swimmer like this. So it's really setting up proper onboarding and integration process. So in that way, you can start with their training and build off of it day by day, week by week, giving them that right support so that they feel like they want to come for day 2. They feel like you're investing in their personal growth and development and their success. And then that's how you stop that high turnover rate from happening. Because actually 22% of employee turnover happens within the first 45 days. So if you basically are, throwing them into the fire, chances are they're going to go home on that day 1 and they're going to be like, I don't know if I want to come back for day 2, or maybe they start looking at the next job because it doesn't feel like it's the right fit for them. So it's really having a good training program in place to actually integrate them properly into your practice.
That's really interesting because people tend to make their decisions, whether they realize it or not. They make them really quick, but then a lot of times people are slow to action. So for instance, if someone's like, hey, I'm thinking about switching SEO providers or whatever the case the dentist calls me, I'm not sure if I really want to stick with them. They've already made up their mind, and they might not know it yet, but they have. The moment you realize that thought is there, it takes an enormous amount of effort to turn someone around and to say, well, maybe you should stay with them, because maybe there's a miscommunication or something like that. Very, very difficult to turn people around. And that's because of what you're describing. When someone goes home and they feel like, hey, this was chaotic, this was not what I expected, whether or not their expectations were reasonable, like you said, the 45 days, that makes sense, because it seems like they got through that first day. They show up on day 2, hopefully, and all is well when you're not that person and they're not communicating with you.
Right.
So that's really interesting to me, because when you describe that, I see someone who has already made up their mind on day 1.
Yeah.
So do you find that to be true in terms of employees? Like the first day, is it kind of like one of those things where it's like you never have a second chance to make a first impression?
Definitely. And because that's when I feel like when I put myself on my first day, you're extremely vulnerable, right? Because you just went from being, for instance, I was working 5 years at the same office, and I knew those systems inside and out, and I could do everything with my eyes closed. And then all of a sudden I'm starting in a new office. It's a brand new program. This doctor does a lot of Invisalign. The other doctor didn't use Invisalign, like different braces, like you're learning everything. So you're extremely vulnerable, and you're really relying on the support of the dentist. You're relying on the support of the office manager and the rest of the team. So it's really just making sure that you have things set up, and not to the point where it's like you've developed these training manuals and you just put them in a room and throw the book on their lap and say, read this, watch these videos, I'll check in with you at the end of the day, right? It's like the impression that you
go over there and watch Laura Hatch. Just watch her, whatever she says. Is she saying something new? Something that I told you to do? She says don't do it. Well, whatever.
Exactly. Like, what impression does that give them? It's like, they feel that you have, like if that was me, I would feel like, okay, well, obviously I'm not that important to you if you feel that everything else that you have to do is more important than helping me on day 1 when I need the most help, right? And then secondly, it's like you almost feel like it's disorganized. Mm-hmm. So you're just, it doesn't leave you feeling good about day 2.
Yeah.
So we work with our clients. We have specific steps on what to do the first day, the first week, the first month, up to the probationary period. So it's really just having a strategic plan, having a mentor that will work with them directly, and to be able to do some regular check-ins with them and just kind of see, day 3, how is everything going with this system or with this protocol, and then just kind of getting their feedback on what they need help with. So in that way, the next week you can go and continue adding on to that and continue growing this individual so that they're adding value to your practice. That's another frustrating thing too, is sometimes I'll see dentists that they just kind of say, well, they're not learning fast enough, I'm going to fire them. Well, did you give them the right resources? Like, did you give them the right support? Like, you want to set them up for success, because when you think about it, your patients notice if you have new employees every single time they come in. And then that might make them feel like, oh, geez, like every single time I don't see Susie here anymore. There's a new girl, there's this new person here all the time. So it doesn't really look that great to your patients as well.
So where are we at? We're on number 4.
Number 4. And so that was implementing an effective onboarding and integration process. And then number 5 kind of continues on along those lines, and that's understanding HR. So along with having a good onboarding and integration process, it's making sure that you have your practice guidelines established. So making sure that you have a good employee handbook, using that job description as well. So in that way, you have your new employee understands what's expected of them on day 1, right? So they understand what their roles and responsibilities are, who they're accountable to, and why you do the things that you do. So that just really also is another level of setting them up for success. And they understand what the workflow is. They understand what your expectations are attendance and punctuality, or vacation or sick time, right? So it's really just getting everybody on that same page. That's what's going to create that good office culture, that establishes good open communication with the team, and then having regular performance reviews and team meetings, right? Getting everybody on that same page is what's extremely crucial to be able to steer your ship into that right direction.
You know, it's really critical that dental offices kind of know where they're going before they start taking a stab at things. And I like that philosophy that you have. What's your mission statement? And the mission statements, let me tell you a little pet peeve I have about mission statements is they tend to be really generic.
Right.
It's like, so do you help dental practice kind of craft something that's unique to them, something other than like, we are commit, like this is the mission statement of like every dental practice I've ever, almost every dental practice that's ever shown me their mission statement: to provide exceptional clinical care with the top of the line technology, and everything else is just fluff.
I agree with you 100%. And I think the mission statement, I always like to liken it to, it's your business strategy, right? This is explaining your why. And I'm really big on Simon Sinek, and I feel like when you understand what your why is, you know what your passion is, you know what the direction you want to take, you know what your purpose is in this life, in this role at this moment. So it's the same thing with your business, right? It's really understanding, how does your business help your patients? How does your business help your team? How does your business help you? How does your business help the community? And this is what's going to kind of give, it definitely needs to be tailored towards them specifically. Because like you said, if I was a patient and if I was kind of shopping around online and I saw the different mission statements and they all kind of sounded like they were cookie cutters or just kind of moved a couple words around, I want to find somebody who I can relate to personally, because these patients are investing their time, they're investing their money, they're investing their resources with you. So people will connect and go to someone that they know, like, and trust. So that also boils down to knowing exactly the direction you want to take and summing it up in your mission statement and or business strategy.
Yeah, no, that's really powerful. And I think that, that mission statement has a good place in marketing. It has a good place in website content, and it's a shame more dental practices don't have that. So where can the viewers find you?
Well, so they can find me on our website, so streamdentalstaffing.com, and also you can find us on Facebook, Twitter, Instagram, Stream Dental Staffing Solutions. And they can reach me directly at samantha@streamdental.ca.
Excellent. Okay, let's recap real quick those five things. Let's do just the the Cliff Notes version of it, the Reader's Digest.
Totally. So number 1 is how to determine who your ideal candidate is by reverse engineering your 5-year growth plan, how to find quality candidates for your position, how to effectively screen and interview, implementing an effective onboarding and integration process, and understanding HR to create the office culture you desire and deserve.
Well, thank you very much, Samantha, for coming on the show. And guys, if you have any questions for Samantha, let us know in the comments below, and she will be glad to get back to you. So thank you, Samantha.
Thank you.
And thanks for watching the Dental Marketing Guy show.